And Cabinet Secretary, like many of the respondents to the consultation paper, I am generally supportive of the intent behind your white paper. I fully support the intention to introduce a legal duty of candour, which will extend to other parts of the health and social care system, the same codes of conduct which apply to doctors and nurses. This will also ensure that Wales is in line with other parts of the UK. So, Cabinet Secretary, do you anticipate that the duty of candour will apply to everyone working in health and social care in Wales? Doctors, nurses and midwives are trained to abide by the GMC's good medical practice guidelines. What guidance and training will be made to NHS managers and social care managers to ensure that they abide by the principles of being open and honest with patients? And can you expand further upon what sanctions could be imposed for any breach of the new duty? I would also be grateful if you could outline the timeline for the proposed introduction of the new legislation. With regards to replacing the CHCs, whilst I support this in principle, any replacement must strengthen the patient voice and not dilute it. I accept that not all CHCs were effective, but there were some very good examples that fought for patients' voices and rights. Whatever the form of the new national arrangement, it is important that we don't lose these patient champions. So can you assure us, Cabinet Secretary, that this new national arrangement to represent the citizens' voice will not only be comprised of mainly citizens, but also truly independent from Welsh Government? Finally, Cabinet Secretary, I welcome the decision not to proceed with the merger of HIW and SSIW. We have to first develop a consistent approach to inspection and ensure that the changes introduced by the Risk Act are given time to bed in before we seek organisational change. We have to ensure that both organisations work closely together in future, and we have to ensure that there are no regulatory gaps. When can we expect to see legislation to address these gaps, Cabinet Secretary? Thank you once again for your statement. I look forward to your proposed legislation and working with you to ensure that our health and social care systems have the needs of the patient at the forefront. Thank you. Diolch yn fawr.
Cabinet Secretary.
Thank you. I'll take those three broad points in reverse order. On inspectorates, as I've outlined in my statement, we're not taking forward proposals to merge the organisations. The challenge, again, comes with any legislative underpinning, as I've indicated. I think there'd be a real opportunity to resolve some of the challenge Healthcare Inspectorate Wales have about their legislative underpinning to allow them to do a more effective job. But this goes into your point about the duty of candour as well, and the timescale for legislation. I can't give you a timescale for legislation because it's up to the First Minister to stand up in this place and indicate the new legislative programme and the timetable for new bills to come forward. But everybody knows that even bills that we may want to bring forward, the reality is that the discussion we just had before this statement on Brexit, well, that may take up more time than this place has to undertake every other piece of legislation that we may want to and think there's value in. So there are real caveats about our ability as a legislature to get through all of the pieces of legislation we want to, and I'm not going to give you any kind of commitment on a timescale because it simply isn't my place to do so. On CHCs, again, I make the point that this is a new body that we're seeking to create to cover health and social care, and I recognise the points about independence. However, the government funds CHCs, so we provide a budget for them. It's a significant budget, well in excess of £3 million to undertake their work. The chair of the National Board is a ministerial appointment undertaken through a transparent public appointments process. So we need to look at what people mean by independent of government. In effect, though, I don't interfere, and I'm not particularly interested in interfering in the way in which the National Board of CHCs operate, or indeed in the way those functions are carried out to support people on the ground in their very important advocacy role. On the duty of candour, healthcare professionals already have their own duties. They're not all covered by the GMC. The Nursing Midwifery Council, the Healthcare Professionals Council as well, including, of course, Dawn Barton's question about therapists, they have different professional and regulatory bodies, but they all have essentially broadly the same duty as healthcare professionals that looks like a duty of candour. What we don't have is something that covers all staff, because not all staff are in those groups, and we don't have an organisational duty as well. And that, again, is some of the work that I'm committing to take forward. And obviously, any conclusions that we reach, we'll come back on, make a statement to this place. And if there is to be legislation, I'll have to front up in front of a committee, but at stages 1, 2, 3 and 4 to do so.